really making leaders more capable of doing their jobs to address health disparities. The third is really looking at all of our systems and figuring out what we can do better within the system, looking at cultural competency and making sure that we're using the data that we have to do a better job. The importance of this is it's not a new thing. It's not a new thing. We need to be able to do a better job with what we have. What we've done within the federal sector is we've established what we call the Federal Interagency Health Equity Team. What does that mean? We've got education working on health disparities, working on improving the lives of young people. We've got the folks at HHS doing the same thing, the folks at USDA doing the same thing. We're all doing the same things in isolation. So what we were told by communities, by leaders across the country is, don't do it alone, do it in partnership. So what I say here is, part of the solution is doing a better job with partnerships. We've talked a lot about what partnerships are, but we have not truly implemented or addressed partnerships in the way that they should be actually effectuated. So what we're doing right now is looking across the federal sector, looking at all these issues that intersect, that we know are causing these bad outcomes, and figuring out how do we bring down the barriers, both in terms of our programmatic barriers, but other barriers that we have specifically set up to do our work, to do a more integrated approach to improving the lives of people. So it's not about new, I think, it's about doing it better, and we're on the path to doing just that.
I must say we must continue to do what we are doing, and the innovation and the energy to do that well has grown exponentially within the last 2 years. And I applaud this administration for that leadership. I will say, as an African American single mom of 2 adult children, that there is a piece that is missing from this understanding. So, and I talked about racism earlier, but ultimately that has to do with the stress that children experience on a daily basis. It starts before birth and continues. And so what we have to become, I believe, is smarter about how we enable anyone who has interaction with a child to mitigate the effects of the broader environmental stressors. And the science is there, and it's also evolving. But there are tools and resources for mitigating stress. Ultimately, it has to do with the quality of the relationships that children experience every minute of their lives. And we can be better at honoring that understanding and making it part of our life and part of how we help teachers and police officers and judges and doctors and nurses. We've got to, it really boils down to our capacity to demonstrate love and caring and not hold that back because of perceived difference or because of judgment.
I have some just specific suggestions for the Department of Education. I think we need a national school health strategic plan. We need leadership from the Department of Education on this issue. They have their Office of Safe and Drug-Free Schools, but it's there, they're doing good things. It's a tiny portion of the budget, and I think they can do so much more to show leadership on this issue. The other thing is, we talked about the importance of school climate and school connectedness. Well, if you don't measure it, it must not be too important. So I think it would be really good to include measures of those issues on the nationwide data collection systems. And then one of their priorities is a focus on persistently low-performing schools. As I said, those 5,000 schools in the United States are the schools where the achievement gap is pervasive, along with extreme disparities in health issues. And we need a serious investment in those schools, much more than we have today. I also would like to see them have a much greater emphasis on health issues in their research agenda. And when I'm talking about the research agenda, I'm not talking about to do more research on the problem. I'm talking about research to put into practice what we already know. That's what's needed now. And then I echo Martha's suggestion about collaboration. These problems of health, education, and poverty are all closely interrelated, but the solutions and the infrastructure is really in silos. You know, we have the education department, we have the health department, we have the social services department, and I think there have been greater efforts to work together. You see it particularly on acute issues like H1N1, but there's a greater need for breaking down the barriers and greater collaboration on a more ongoing and regular basis to think about, you know, the Department of Child Well-being and Child Human Development. And the most important issue is really about political will, and that is to what extent this issue is seen as a fundamental part of the mission of schools. There's been, obviously, literacy and numeracy are key issues, but to what extent do we as parents, as citizens, see the school's role as cultivating the overall human development, social and emotional development of young people? We're the only country in the US that has such a decentralized educational, only country in the world other than Canada, that has such a decentralized control of the schools. So we as local communities have to decide what's reasonable to expect from schools. I clearly agree with Terry. They cannot and should not be expected to solve the problems. But at this point, as you point out, they're probably the major safety net for thousands of kids in America.
If we start with the vision of public education in this country as development of the whole child, intellectually, emotionally, physically, socially, I think that's an important starting point that then needs to be embraced in the reauthorization of ESEA, and then that would drive moving beyond a set of very narrowly defined standardized test scores to measure school progress in this. Because I would like to then also enact a policy where Dr. Shukar, if he doesn't eliminate teen pregnancy by 2014, we're going to close him down. And if Terry Hillard and his successor does not eliminate shootings and homicides in our community by 2014, we'll shut him down too. And yet that's the strategy for our public schools. And it does not seem to make a lot of sense there when we are looking at it. So I get that we need to hold the adults accountable in the system, but I think that we've got to look at the ways in which things like an integrated set of government services, the cross-agency collaborations that President Obama brought into bear in his first months in office. I was intimately familiar with the Green and Healthy Homes Initiative, bringing HUD together with HHS, EPA, and all of these strategies. And then you've talked about what's happening with your office across the board, that integrated solutions need integration among the departments that share responsibility to enact these. These are the new ways that we've got to move forward in this time of new normal.
I think from my perspective, on March 23rd, 2010, the Affordable Care Act became law, and that health reform really set a great foundation to reform our healthcare system. And we started to see a shift from focusing only on medical care to really start to put some more emphasis on prevention and public health. For the first time, we have now, the president has now a public health council that's advising him on public health priorities issues. That public health council is developing public health strategy for our country, which again is extremely important. So as we think about that, and in addition to the creating of the Public Health Council, within the Affordable Care Act, there was a $15 billion over a 10-year fund, which is the Public Health and Prevention Fund, to really help support a lot of the activities that we've heard about today, whether from research or the Office of Minority Health or from the work that we're doing in school, that really helps us think more about environmental changes, policy changes, And Chicago was very successful at competing and getting some funding through that fund to really start see the needle move on these major public health priorities. So as the budget discussions continue to happen in DC, my request would be to make sure that this fund is staying there and strengthened as we move forward.
And before we go to the second question, I must feel compelled to comment on the first. Particularly as Dr. Shuker was talking about the National Prevention Plan. You know, we really at Healthy Schools Campaign have seen the wonderful work that school nurses can do. And right now, school nurses are funded through education. And I think that, you know, if we look at school nursing, not just school-based healthcare, but school nursing as an important part of our national prevention plan. I think we can come up with some different ways to share of how to finance school nursing that could really bring school nursing back to every school. And a Healthy Schools Campaign, we have a long program with school nurses. We do see the wonderful things they do, and they'll actually be meeting a group of them all day today, refining their skills and gaining knowledge, and I believe that's the table of school nurses there. So,